Propofol. Expanded lecture notes. Propofol is a widely used and highly effective sedative hypnotic in anesthesia and critical care. Understanding Propofol's benefits: fast onset, quick recovery. Risks: hypotension, respiratory depression. Clinical use: anesthesia, ICU sedation. Helps healthcare providers use it safely and effectively for patient care. Introduction. 1. Propofol's widespread use. Propofol is a widely used intravenous anesthetic agent that has become the mainstay for induction and maintenance of anesthesia and sedation in ICU patients. Mainstay means it's a primary or commonly used option. 2. It's favored. It is favored for its rapid onset. Starts working quickly, short duration of action, effects wear off quickly, and predictable recovery profile. Patients recover in a predictable way. 3. Propofol's formulation. It is a lipid-based formulation. Made with fats with a distinctive milky white appearance. Looks like milk due to the lipid base. Definition of Propofol. Propofol 2,6-diisopropylphenol is a short-acting, lipophilic intravenous sedative hypnotic agent used for induction and maintenance of anesthesia and sedation in various clinical settings, including the ICU. As American Society of Anesthesiologists (ASA) recognizes Propofol for anesthesia and sedation. Society of Critical Care Medicine addresses Propofol's use in ICU sedation. U.S. Food and Drug Administration (FDA) approved Propofol for specific anesthesia and sedation indications. Classification of Propofol. 1. Pharmacological class. Intravenous general anesthetic. Used to induce anesthesia via IV. 2. Therapeutic class. Sedative hypnotic. Used to calm or induce sleep for medical procedures. 3. Chemical class. Alkylphenol derivative. Chemically, Propofol is related to alkylphenols, a group of organic compounds. Chemical properties. 1. Chemical name. 2. 6-diisopropylphenol. 2. Molecular formula. CHO. 3. Molecular weight. 178.27 grams per mole. 4. Appearance. Milky white emulsion due to lipid vehicle. 5. Solubility. Highly lipophilic, insoluble in water, soluble in lipids. 6. Formulation. Emulsion with soybean oil, glycerol, and egg lecithin, pH 6 to 8.5. Mechanism of action of Propofol. Propofol enhances the inhibitory effects of gamma-aminobutyric acid, GABA, at the GABA receptor complex. 1. Increases chloride ion conductance leading to hyperpolarizes neuronal membranes leading to reduces excitability. Increases chloride ion conductance. Lets more Cl ions into neurons. Leading to hyperpolarization. Makes neurons less likely to fire. Of neuronal membranes leading to reduced excitability. Neurons are less active. 2. Causes generalized CNS sedation leading to hypnosis, sedation, and anesthesia. Causes generalized CNS. Central nervous system. Depression leading to hypnosis. Induces sleep, unconsciousness, sedation. Calming effect, and anesthesia. Loss of sensation, consciousness for surgery. Pharmacokinetics of Propofol. 1. Absorption. Given intravenously. Rapid brain uptake. 2. Distribution. Highly lipophilic leading to rapid distribution to CNS leading to quick onset, 30 to 40 seconds. 3. Metabolism. Primarily hepatic, glucuronidation and sulfate conjugation. 4. Elimination. Mainly via urine, inactive metabolites. 5. Half-life. Context-sensitive half-time is short after brief infusions but can be prolonged with extended use. 6. Clean binding. Approximately 98%. Clinical uses. 1. Induction of anesthesia. Standard agent for most cases. 2. Maintenance of anesthesia. Infusion or intermittent bolus. 3. Procedural sedation, e.g., endoscopy, cardioversion. 4. Sedation for mechanically ventilated patients in ICU. Control of refractory status epilepticus. Off-label. 5. Antiemetic effect. Low-dose infusion reduces postoperative nausea, vomiting. Use in ICU. 1. Continuous infusion for sedation in mechanically ventilated patients. 2. Preferred for short-term sedation, less than 48 hours, due to rapid recovery profile. 3. Allows neurological assessment due to quick awakening when stopped. 4. Avoid prolonged high-dose use due to propofol infusion syndrome, pre-risk. Use of propofol in anesthesia. 1. Induction of anesthesia. Propofol is commonly used for induction. Starting of general anesthesia due to its rapid onset and smooth induction. 2. Maintenance of anesthesia. Can be used for maintenance. Continue of anesthesia via continuous infusion, often with opioids or other agents for balanced anesthesia. 3. Rapid recovery. Allows for rapid recovery. Waking up quickly after stopping the infusion, facilitating post-op assessment. Use of propofol in emergency settings. 1. Procedural sedation. Propofol is used for procedural sedation. Sedation for short procedures like cardioversion, endoscopy in emergency departments due to its rapid onset and short duration. 2. Rapid control of sedation. Allows for quick control of sedation depth and rapid recovery. 3. Caution needed. Requires careful monitoring of breathing, blood pressure due to risks of respiratory depression and hypotension. Administration and dosage of propofol. 1. Adult induction. 1.5–2.5 mg per kilogram IV bolus, reduced in elderly, hypovolemic, or debilitated patients because they may be more sensitive. 2. Maintenance anesthesia, 12 mg per kilogram per hour IV infusion or 100 to 200 microgram per kilogram per minute. 3. ICU sedation. Initial, 5 micrograms per kilogram per minute. Titrate by 5 to 10 microgram per kilogram per minute every 5 to 10 minutes. Achieve desired sedation. Usual, 5 to 50 microgram per kilogram per minute. Avoid more than 4 milligrams per kilogram per hour for over 48 hours to reduce risk of propofol infusion syndrome, pre. Side effects of propofol. 1. Hypotension, low blood pressure due to blood vessels widening and heart pumping less forcefully. 2. Bradycardia, slow heart rate. 3. Pain on injection when propofol is given IV, minimized with lidocaine, numbing medicine, or using a larger vein. 4. Respiratory depression, slowed breathing, or apnea, stops breathing. 5. Myoclonus, sudden muscle twitch, rare. Serious side effects of propofol. 1. Propofol infusion syndrome, pre**. 1. Rare, life-threatening. 2. Features: metabolic acidosis, body too acidic, rhabdomyolysis, muscle breakdown, hyperkalemia, high potassium, cardiac failure, renal failure, death. 3. Risk factors: high doses, more than 4 mg per kilogram per hour, prolonged infusion, more than 48 hours, critically ill patients, use of catecholamines, strong heart drugs, or steroids. 2. Severe hypotension can occur with rapid bolus in hypovolemic patients, those with low blood volume. 3. Allergic reactions. Rare, caution with egg or soy allergy because propofol is formulated with lipids, fats, that may contain egg or soy components. Contraindications of propofol. 1. Known hypersensitivity to propofol, soy, or egg products. Can't use if allergic to propofol or its components, like soy or egg in the lipid formulation. 2. Severe hemodynamic instability. not ideal in patients very unstable blood pressure or heart function. 3. Known or suspected pregnancy for anesthesia except abortion procedures, unless benefit outweighs risk. Generally avoided in pregnancy unless necessary and benefits outweigh risks. 4. Children less than 16 years ICU sedation, due to pre-risk, *. Not recommended for ICU sedation in kids under 16 because of risk of propofol infusion syndrome pre. Precautions for propofol. 1. Elderly, debilitated, or hypovolemic patients, reduce dose because they may be more sensitive to propofol. 2. Patients with lipid metabolism disorders, caution needed because propofol is lipid-based. 3. Risk of bacterial contamination. Strict aseptic technique needed when handling propofol to prevent infection. 4. Monitor for propofol infusion syndrome in prolonged or high-dose use to catch serious complications early. Advantages of propofol. 1. Rapid onset and recovery, works quickly and patients wake up fast. 2. Smooth induction and emergence, smooth start and end of anesthesia. 3. Decreased incidence of nausea and vomiting, less sickness after anesthesia compared to some other agents. 4. Suitable for day case surgery, quick recovery helps patients go home sooner. 5. Antiemetic properties, helps prevent nausea and vomiting. Disadvantages of propofol. 1. Pain on injection can cause pain when given IV, often managed with lidocaine. 2. Cardiovascular depression can lower blood pressure and affect heart function. 3. No analgesic effect, doesn't reduce pain, so often used with analgesics like opioids. 4. Risk of propofol infusion syndrome with prolonged high doses, serious condition with long-term high-dose use. 5. Requires strict asepsis, needs careful sterile handling to prevent infection because it's a lipid emulsion. Clinical considerations for propofol. 1. Always combine with an opioid for painful procedures, to manage pain since propofol doesn't provide pain relief. 2. Use lower doses in elderly or unstable patients, because they're more sensitive to propofol's effects. 3. Monitor blood pressure, heart rate, and respiratory status continuously, to catch any issues like low blood pressure or breathing problems. 4. Avoid prolonged high-dose ICU sedation, to reduce risk of propofol infusion syndrome. 5. Discard opened vials 6 to 12 hours due to infection risk, because propofol is a lipid emulsion that can support bacterial growth. Comparison of propofol with other agents. 1. Onset. Propofol, etomidate, ketamine, rapid 30 to 60 sec. Midazolam, slower 2-3 minutes. 2. Recovery. Propofol, fast. Midazolam, slower. Etomidate, fast. Ketamine, moderate. 3. Cardiovascular effects. Propofol, depresses. Midazolam, mild depression. Etomidate, stable. Ketamine, increases BP and HR. 4. Analgesia. Only ketamine provides analgesia. 5. ICU use. Propofol, preferred for short-term. Midazolam, preferred for long-term. Etomidate, rare. Ketamine, for specific cases. Conclusion about propofol. 1. Propofol is a cornerstone agent for anesthesia and ICU sedation due to its rapid onset, short duration, and predictable recovery profile, makes it a popular choice. 2. While highly effective, it requires careful dosing, as it can cause low blood pressure. 3. Monitoring for cardiovascular depression is needed, since it can affect heart and blood pressure. 4. Vigilance for propofol infusion syndrome during prolonged infusions is important to catch serious complications early. 5. When used appropriately, it provides excellent sedation and anesthesia with minimal hangover effect. Patients recover quickly and clearly. If the study translates directly to humans, Propofol may produce enhanced recall of a traumatic event if administered shortly afterward. J. Lance Lichter in an editorial for Anesthesiology. This quote highlights a discussion on the potential effects of propofol on memory after a traumatic event, based on a study involving rats. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.